Okay, what's ARFID? ARFID stands for Avoidant Restrictive Feeding Intake Disorder. Now, people with ARFID oftentimes look like people with anorexia. They have significant weight loss, they restrict, they don't eat. They often suffer medically from similar outcomes, such as nutritional deficiencies and cardiac abnormalities. Typically, people who suffer with anorexia or other forms of disordered eating are rooted in body image and body dysmorphia issues, or some sense of their appearance being affected by their eating and their weight. People struggling with ARFID don't have a body dysmorphia or body image issue. They don't eat because they can't tolerate certain textures, or in the past they may have choked or had some sort of trauma associated with eating. So if you think about people with sensory issues, like people who are neurodivergent, ADHD, autism, those folks often have really big issues with different sensations. And that can lead to them avoiding entire categories of food or only eating one food. But ARFID is a reduction in eating and a significant weight loss that's caused by it. And in psychiatry, we often don't get biomarkers, but I do think there is a biomarker that's relevant for ARFID. Ghrelin is known as your hunger hormone. The higher ghrelin you have, the hungrier that you are. Now, in patients with anorexia, their ghrelin levels are elevated because they are hungry and they want to eat, but they are actively avoiding and restricting to lose weight. Even anybody who goes on a regular diet, over time they will have higher ghrelin levels. People with ARFID who are not eating do not have an elevated ghrelin level. They have a lower ghrelin level. And in fact, in this study, it kind of gives you the result in the title. Lower ghrelin levels are associated with higher anxiety symptoms in adolescents and young adults with avoidant restrictive food intake disorder. In their results, ghrelin levels were inversely associated with anxiety symptoms. I always find it rather fascinating and cool how something like a hunger hormone can relate to anxiety symptoms. But then the natural question arises, is ARFID causing a reduction in ghrelin levels? Or is a reduced ghrelin level predisposing people to developing ARFID and other disordered eating, and even other anxiety disorders? Maybe one day a treatment for anxiety could be to give somebody ghrelin if their anxiety is rooted in low ghrelin levels. I just thought that was cool, and I did not have enough time or eloquence to say that in the 2.5 minute news segment. Let me know if you found this cool or have any questions below.